day we're in Portcullis House, which apparently is where all the MPs gather, and we're holding a special day for homeless people and their care in the community, mainly eye care, of course, and some of the difficulties that homeless people face in trying to get a basic pair of glasses.
You know, it sounds like such a simple thing, but we take it for granted being able to see, but that can really affect your quality of life. I experienced different types of homeless. I spent a lot of time rough sleeping, so, you know, you think of people, you know, living in towns, you know, and bus stops and things like that. I always slept in a field because I didn't want people to know what I was going through. And the longer that someone is homeless, the longer it's going to affect their self-worth. I didn't access care for about 7 years after I was homeless.
There are 2 million people living with sight loss, with this number set to double by 2050. And this is costing the UK economy 36 billion a year. And we know there are huge pressures across the NHS for all health conditions, but in eye health, the situation is quite serious. We need to ensure that those suffering homelessness have full access to services, as they are significantly more likely than the general population to experience eye health issues.
If you imagine you've moved area to somewhere you're not familiar with and you've lost your glasses and you can't see and you can't apply for a job because you can't see where the job centre is, or you can't use your phone, or, you know, fill in forms, it's going to really affect your quality of life. So it's not just about, you know, being able to see or even healthcare, it's being able to provide people with a good quality of life and giving people the opportunity to be able to progress with their life and get out of homelessness and be able to live a normal life. It's very impactful, and we take it for granted.
Crisis did a very good survey, and they found that 80% of the people they were looking after needed glasses.
What's frustrating about the industry is we have a lot of resource, we have a lot of colleagues, but there are unnecessary barriers to accessing care. So people that really need the services currently can't get them.
There's lots of barriers, and it will absolutely vary from person to person. I think the fact that people are concerned that they're not eligible for the eye test or the provision of glasses and that they would have to pay for them is absolutely a barrier. And understanding if they are eligible or not. So we often get people who come to us who know it's free of charge but actually are eligible but didn't realise that they were.
The way NHS eligibility works is you can only claim NHS care if you're eligible for certain reasons. If you're homeless, you don't automatically get NHS help. So the only way of getting that is sending a form off and waiting for a response. But if you imagine if you're moving around a lot, that's going to cause delays to being able to access the care. So these are barriers that don't need to be there and need to be changed.
It's important to remember that homeless people are not just living on the street, but they could be in somebody's house sleeping on the sofa, maybe sleeping in their car, or they could be in a hostel. So they've been left out, and it's this inequality that I get quite worried about.
The ability to be able to put the store address down if you're homeless was a big change, but again that only applies to people that fall under the normal NHS eligibility criteria. So the change that I want to see is that if you are homeless, that you do get access to care at point required as part of the NHS eligibility, as opposed to having to wait for forms to come back. It's just unnecessary, and there are people that really need eye care, and it's a big thing to be able to see, and it helps you to be able to find a job and read your medication and be able to see where you're going. So these are really unnecessary barriers to providing someone a good quality of life.
Sometimes the idea of going into a local high street optician, the people see it as a retail environment and not a healthcare environment, because it feels very different to go to your doctors or to the hospital. So people can be put off by that, and some of those are just perceived barriers rather than real barriers, but it absolutely puts up that kind of barrier for people accessing the eye care that they need.
Now, I know I stand here, and I'm sure most everybody in this room would agree with me that we need to urgently remove these barriers. And I commend Specsavers and all the team there for their work in highlighting these inequalities.